Hello everyone. Good morning, good afternoon. We're going to slowly start while some other colleagues connect. But we're really excited to be here all together on this launch of the Junior Doctors Network Global Working Hours Study. We're super excited also to have our great guest speakers for today to make this historical moment for junior doctors research a great day. So to set a bit the scene, today we have with us Dr. Kalin Matar. She is Associate Professor of Medicine at Washington University School of Medicine in St. Louis, also JDN Past Chair, and the current World Medical Association Medical Advisor. Welcome, Kalin. Um, Together with us, we also have Dr. Jack Resneck, a dermatologist and health policy expert from the San Francisco Bay Area, past president of the American Medical Association and the chair of council of the World Medical Association. Welcome, Jack. We also have with us Dr. Juan Pablo Carrasco. He's a child and adolescent psychiatrist based in Spain. He currently serves as the international officer of the Spanish General Medical Council Junior Doctors Section at the Spain and as Spain's representative to the European Junior Doctors. He's also a member of the UM's Child and Adolescent Psychiatry Section. Welcome, Juan Pablo. And finally, last but not least, we have Maren Hopfe. She's Dr. Maren Hopfe. She's a technical officer, health service in the health services sector at the Sector Policies Department at the International Labor Organization, and her work focuses on promoting rights at work, encouraging decent employment opportunities, enhancing social protection, and strengthening social dialogue in the health sector. She coordinates the ILO engagement in the joint ILO OECD WHO Working for the Health program, which aims to assist countries to expand and transform the health and the social workforce to reach the SDGs 2030. She holds a PhD in health sciences and health policy and gained practical experience in various fields of health systems, including finance of startups, projects in the health technology industry, project management, of a client relation in clinical trials, maintenance of international health classifications and standards of global level, and their implementation in national health and reimbursement systems, as well as impact assessment of rehabilitation services. So welcome, Maren. Really nice to have you here. And my name, I'm Dr. Pablo Estrella. I'm a medical doctor from Ecuador and a public health and preventive medicine specialist based in Spain, as well as the chair of the Junior Doctors Network of the World Medical Association. We have come together today and first probably to set the scene on why it's so important to have robust data on junior doctors, working hours, rest and training conditions, which really matter in the health workforce crisis. It has been underscored the projected global health professional shortfall of 11.1 million by 2030 and call for investment, disaggregated data collection and promotion of safe and inclusive working environments is needed. The workforce is the backbone of the resilient health systems and collective action is a moral imperative. And of course, junior doctors are also a key part of the healthcare workforce crisis. Therefore, we have been developing a project together with some partners where we wanted to bring some evidence into the current situation of working conditions, working hours, and satisfaction of junior doctors. Without any further ado, I would like probably to start with one of our speakers, with Dr. Jack Resneck. So, Dr. Jack, I would like to ask you, what are the most critical features of the current health workforce crisis affecting junior doctors, and how do they differ across regions or specialties?
Pablo, thank you so much, and thank you to the JDN for organizing this webinar. I am really thrilled to be here to help kick off the webinar, launching this Junior Doctors Network Global Working Hours Study. It's a good question. You know, our real experts are going to be presenting in a couple of minutes, but I did want to just take a minute first to introduce this important survey and sort of underscore why this is a priority issue for the WMA and for our national medical associations across the globe. And I was thinking a little bit this morning about this as an evolving issue. In my own residency training, I won't say exactly how many years ago that was, but let's just say 2 decades or more. I was personally involved at that time in leading some of the early resident work hour reforms in the United States, but there are so many reasons that this remains an important issue. And as you said in your question, really across specialties and geographies. Let me just back up for a minute and start with the backdrop of the global health workforce crisis itself. So we have a projected shortfall now of 11 million health professionals by the year 2030. And it's not something that's looming and coming, it's really already here. And we hear about it in certain specialties, we hear about it in certain geographies, but it's basically affects everybody. It's especially true, of course, in primary care, but also in pretty much every specialty. It's certainly pronounced in rural areas, but it's also in urban and suburban ones. It's certainly more dire in low and middle income countries, but it's also true in countries at all levels of development. It's driven by a few things. I think underinvestment in education and training is a major one that we see in many places. It's driven by a rising demand for care. We certainly have an aging population around the globe that is sicker and needs more health care. We have new technologies that are improving our ability to prevent and diagnose and treat disease. So there's more for us as physicians to actually offer and do. And fortunately, we do have improving access to care in some places. And so that drives demand as well. And on the other side from demand, we also have from supply, from demand for care, we also have a supply issue with a shrinking effective workforce. So we've certainly seen, and it's gotten worse since the COVID pandemic, more burnout that's driving more retirements, transitions to other jobs not involving patient care. We see more physicians choosing part-time work. And of course, it's compounded by migration to other geographies when countries don't support the working conditions of practicing doctors. And practicing doctors are the linchpin of this workforce. Healthcare teams with diverse training backgrounds and credentials are really important parts, critical parts of delivering care. But those with the most training, physicians, are really the necessary leaders of those teams. So growing that workforce requires paying attention to sort of both ends of the career pathway or pipeline. I think about sort of the back end. I mentioned people retiring. So we have to improve working conditions to avoid people leaking out of that system and retiring early and losing those trained physicians. But we also have to improve the capacity and the working conditions of medical training to inject more people into the workforce at the front end. We know junior doctors, particularly those in postgraduate and residency training, experience some of the greatest pressures while simultaneously really having some of the most vulnerability. And see countries where, as you know, they're unpaid or forced to even pay for their training. We see places where they're pressured into working really absurd hours that we know are not safe for them or their patients, and even discouraged from accurately reporting them in places that have tried to have regulations around monitoring those work hours. So while we need more training slots to address the shortage itself actually reverberates back and leads to some of those worse training conditions as the pressures are put upon trainees. So it's a major issue, and I'm glad you have gathered some experts to tell us more about it today.
Thank you so much, Jack. And how would you say that unsafe working hours and inadequate rest can impact on the retention, the migration, and also the patient safety? I know that you already have addressed this, but
Yeah.
probably if there's some minimum standards that we should try national medical associations to advocate for.
I mean, this used to be an issue that we came at just because we felt it all in our guts, but now in the last 2 decades, we actually have a substantial evidence base. So when you look at work hours, and certainly we do believe in some flexibility for different countries and different specialties to handle it differently. The exact work hours requirement for a surgeon might not be the same as for a psychiatrist, but we have strong data that shows when people work too many hours, too long a shifts, that the quality of care starts to go down and it raises safety issues for patients. And we know it's not safe for those trainees as they are driving home from work and other things that we see major safety risks. So we do believe in and support caps on those working hours. The medical training system has also developed a lot of evidence base on the fact that we know we can still provide outstanding training and make doctors who will take great care of patients despite those working hours restrictions. Again, certainly see issues with knowing, for example, a surgeon and how many cases they need to do, but the system has really adapted to be able to function in this space. So those standards are very, very important, and I know some of the people who are following me might get into the specifics of what they need to look like.
Perfect. And thank you so much, Jack. I think you have set up the scene really well and also gave us also some hints of where can we start advocating for. I think this is a great transition also now to ask Dr. Maren from the ILO perspective. ILO has championed the decent work agenda in the health and social sector. So could you briefly review the main elements of decent work?
Yes, thank you. Thank you so much for the question, but also thank you very much for the kind invitation to participate in this event. It is such an important topic. And maybe for those of you who are not really familiar with the International Labour Organization, let me begin by quickly telling you that the ILO is the United Nations agency that is mandated to promote decent work and social justice for all. And we actually do that through international labor standards, to policy guidance and tripartite cooperation among governments, workers, and employers organizations. And in fact, we are the only UN agency that is tripartite, meaning that governments, employers, and workers have an equal say. But to turn to your question on what, the decent work agenda is and what we're advocating for. So the decent work agenda is built around 4 strategic objectives. That is employment, that is rights at work, social protection, and social dialogue, with, gender and non-discrimination sort of being cross-cutting themes throughout. So when we talk about decent work, it is not just about having a job, but it's about having a job of good quality. So that means that it is productive, it is fairly paid, it is safe, and that it comes with social protection. So let me dive a little bit deeper into, these 4 strategic objectives, a little bit from a health sector perspective. The first pillar on employment creation, employment opportunities is that decent work actually starts with access to jobs. And we've heard it already. The health system is facing a severe shortage of health workers, projected to be around 11 million in 2030. And we know that addressing this shortage, and it has been alluded to already, requires more than simply increasing the numbers, but we have to make sure that the jobs are fairly paid, that the contracts are stable, but also that there is opportunity for skills development and career progression. And we also know that when workloads are high and there are excessive working hours, or that learning opportunities are actually limited, it becomes super difficult to attract and retain health workers, which is then worsening the shortage. The second pillar about rights at work is really about the fundamental principles and rights at work, which include fair treatment, non-discrimination, safe working conditions, and the right to organize and to participate in dialogue. So occupational safety and health is a core part of these rights. And we have to ensure that health workers are protected from the various and many hazards and risks that they face actually every day, which includes protection from infectious diseases, ergonomic risks, but also the risk to stress and fatigue. But it also means protecting health workers from violence and harassment and ensuring safe staffing and working hours with sufficient rest periods. And all this is actually really essential to ensuring that health workers are supported and protected, but ultimately also to ensure a safe and quality service provision. The third pillar about social protection means that actually it is important that health workers are protected themselves, that they have access to social protection, that they have access to health services themselves when they become sick or if there is an illness, or also that they have access to security protection in the case of income loss. So paid sick leave, maternity protection, paternity, decent work actually really means that all health professionals, whether they are on permanent or on short-term contracts, have access to these type of protections. And last but not least, social dialogue. So our experience actually really shows that practical and sustainable solutions can best be found when all those concerned have a voice and work together. So decent work really depends on social dialogue, which means, as I mentioned, that employers, workers, and governments are actually sitting together at the same table to tackle the complex challenges that the health workers are facing nowadays. And that includes actually tackling the issues of working time arrangements that we're discussing today. So this ensures that the policies and the measurements that are being taken are actually really reflective of the realities of health workers and their workplaces today. So as I said, in a nutshell, decent work is not just about creating more jobs, but actually making sure that these jobs offer conditions where health workers can work in dignity and in security.
Thank you so much, Maren. And I think outlining how it should be the decent work with all its components, it's also a core reason of why we are today launching this global study on working hours and working conditions. The European junior doctors already did this study. We will discuss a bit more how we based our global study on this one, and they already presented the report. But I would like now, Maren, to ask you from your perspective, sorry, how can a study like this one, the one that the Junior Doctors Network is launching, can move the needle on working conditions for junior doctors globally?
Yes, thank you very much for the question. So first of all, let me actually really highlight that I think the study is very timely and it is very important. Working time is the foundation for decent work, and particularly junior doctors, and as Whit mentioned, it is not only a defining part of both their working conditions, but also about their training experience. Coming to your question, I think, three areas that I would like to highlight in terms of how the study can actually move the needle. The first one is it creates a strong evidence base to protect health and safety of junior doctors. In the health sector, we are very much challenged to actually really balance the need for a 24/7 service delivery with decent working time arrangements. But when we talk about working time, it is not only about having hours on the schedule, but it is about a safety aspect. It's about quality of care. And we need to know that unpredictable hours, limited rest, and high workloads increase really fatigue, they increase stress, they increase burnout, but also they increase the risk of medical errors, which actually puts patients and health workers themselves at risk. So the ILO has some working time standards that emphasize the need for limits on hours and the need for adequate daily and weekly rest and compensation for rest. And by documenting with your study the realities of junior doctors, of the schedules, of the working hours, I think the study can really provide the data that is needed to show where these principles are actually not yet fully being met, and where some adjustments are actually being needed. Second, I think it can improve job quality, safety, and also the attractiveness of the profession. So the study shows how working time shapes the broader working conditions of junior doctors. And a recent report by WHO and OECD actually shows that young people's interest in health career is declining. And excessive hours, lack of rest, and limited training opportunities make it much harder to attract young professionals into the medical profession. So working time is one part of that to look into attractiveness, but also it is central to occupational safety and health, which is a fundamental principle and right at work. So we need to ensure that junior doctors are protected from fatigue, from stress, from infection risks, from ergonomic strain, but also from violence and harassment. And I think the study clarifies how long and irregular hours increase these risks and why it is so important to have working time being part of occupational safety and health systems at health facility level. And third, I think, as I mentioned before, the study can provide a good foundation for improved social dialogue and also for shared solutions. So with the results of the study, I think there is some solid evidence on the issues, and it gives junior doctors something to engage more effectively in negotiations on staffing, on scheduling, on rest periods, on training time, on working time in general. And that ensures that their voices and that your voices are actually heard when discussing policies and measurements. But also it can facilitate global learning, because I think what we know is that many junior doctors around the world and many countries and many systems are actually challenged by the same issues. And with the study, you can facilitate some joint learning and actually discuss what works, but also what doesn't work. What are measures that can improve the situation, and what are actually measures that might make it even worse and that are not aligned with international standards on working time. So I think there is a lot of potential for the study to actually turn, all these individual experiences that you all bring to the table into really practical solutions that can help advance decent work in the health systems.
Thank you so much, Maren. And this is really inspiring on now, on the moment that we are at the are right now, where we're about to launch it. But also, we know that there has been already some results from people that have been doing this research before on different levels. And I think it's a great transition also to go now with Dr. Juan Pablo Carrasco. As the Spanish representative of junior doctors, I know that in Spain, and there was already a study, actually was one of the original ones. But I would like to ask you, Juan Pablo, what made the Spain study feasible and impactful? Why would you recommend replicating a study like this one? And also, how were results used in negotiations or policy discussions, and what quick wins should others target first whenever doing this kind of research?
Thank you, Pablo, for your questions and for inviting us here with all of you. It's a pleasure to be here with all the speakers and all the people who are watching us. We are really happy to present our studies because we really believe this is important. We really agree with all the speakers on this is not the only thing talking about satisfaction and mental health conditions of the health workforce, but working and resting times, it's a really important part of it. I'm going to use a brief presentation just to show some parts of the studies we published. It is working, Pablo?
Yes, we can see your screen.
Perfect, thank you. It all started when I think it was in my second year of the psychiatry residency. I was still doing emergency for psychiatry and also for general medicine. Some colleagues and myself, we were seeing each other. We were seeing that other colleagues were suffering with the working times, dealing with these almost mental health conditions, and we thought, okay, we are part of the local medical council. Why don't we contact with the rest of the regional medical councils, or even with the Spanish General Medical Council, with the junior doctor section, to really try to see if this is true, if this really high amount of shifts we are doing, it's the same that is happening in the other part of Spain. So we began this study about working and resting times, trying, in our case, to compare it with the European Working Time Directive and the 20 to 48 hours compliance. And I think, answering to your question, one of the main points of our study was to doing through the Spanish General Medical Council, because it is a huge study trying to reach so many people of so many different places. And I think that doing this study we are presenting today, doing it through the World Medical Association, I really think it's a really, really great success. It's a really great idea, because for us, we needed the support of such a big organization to really be able to reach the medical residents. I'm not going to present the results, because you can imagine almost all residents wasn't respecting the working times that the European Working Time Directive says. But I think that now we have the opportunity to reach a lot of people of different parts of the world. In our case, we used a lot the social media of the Spanish General Medical Council. This structure we had of regional medical councils, which is more or less similar in a way of the World Medical Association and the Junior Doctors Network one. And we tried to reach as many people as we could, and the results showed that almost in all parts of Spain, the compliance was not very good, talking about working times, but also about the resting times after the 24 hours shifts that we have in Spain. And beyond the results, I think it's important to talk about how we use the results, because it has really made an impact in Spain. We presented it to the press. We did a presentation, the junior doctors section and the Spanish General Medical Council, and like the major union in Spain. And we have presented it in an event with the Spanish Parliament and with the Spanish Ministry of Health. And we reached almost like more than 200 news in the newspapers, in the television, because it was the first to do a study of this kind in Spain. We didn't have even a study like that in senior doctors or in full medical specialists. So we were the first doing a study of its kind, and people were surprised about the results. And in fact, I think it was powerful, because even now in Spain this month, we're having like a strike and some demonstrations with against the Ministry of Health, or negotiating with the Ministry of Health about some reform they are proposing. And the main arguments and the main resources people is using to support the demands they're doing, it's our study, because it's the only one to really say, okay, we are complaining and we want better conditions, because we know, and we have published a scientific study published in a Q1 journal that says that the law is not being respected, that working times has to really improve in our residents, above all in the first and second year of the medical residency, which are crucial to decide the career of a person, talking about this healthcare workforce crisis we're facing now. So the impact that we have had with our study has been like really great in the press, in the part of unions and labor, and also in the like to do this policy and political work with the Ministry of Health.
Amazing. Thank you so much, Juanpa, for showcasing this. It's true that I also had the privilege to work with Juan Pablo and the Spanish team at some point of this study, and seeing also the impact that locally it can have when you bring together evidence into action and advocacy, has also some great results, and is also big part of the inspiration of how this global study of working hours has been born. I don't know, Juanpa, if you have any other slides, or we're good. Perfect. Thank you. So I'll take over again the screen. And now I would like to jump to Dr. Kalin Mata. Kalin, of course, is a great supporter of the Junior Doctors Network, but also co-organizer of this study. Will bring us also some more information of how was the study design, the target group that we use, how it was created, this study, who is supporting us, and a bit more of why it's so important to launch today officially this global study on working hours and working conditions.
Thank you so much, Pablo. Also, thank you to all the great speakers who preceded me and helped me set the scene for what I'm going to talk about next. I think briefly mentioning how this study came about, I think we heard from Juan Pablo, but also I saw Alvaro briefly, the president of the European Junior Doctors. I think this has been a fantastic opportunity to collaborate and think together and be really inspired by the work of the Spanish Junior Doctors, and later on by a regional collaborative, which is the European Junior Doctors. And the great report that they have presented, which I know we will be hearing about soon in an upcoming webinar. But just reflecting a little bit why I think this is of particular importance, and why working with the phenomenal Pablo Estrella, we've and the JDN management team, we've launched this study, and we're hoping that we can get quite a bit of data. I will mention, Pablo mentioned that I'm currently an academic physician in the United States, where I've done my residency training, subspecialty training, and I've been practicing in a university setting for a while. I trained in Lebanon for medical school, and I practiced a little bit before moving to the United States. And I will tell you that in Lebanon, there is no accrediting body for residency training. There's nobody talking about working hours of junior doctors or any doctors to begin with. And this is not an uncommon issue. I think many people, this might resonate with many people around here who either don't have accrediting bodies in their countries, or maybe an accrediting body that's not particularly concerned about these small details. I think hearing from the European region and a European country where there is a clear directive on working time, which is also something that is very present in many countries, but somehow doctors are not included in the group. So that is one reason why this particular study is of essence. But on the other hand, there are parts of the world where I trained, where I practice, where I've had a great career so far in the United States, where a different issue brought the working hours to light. And I think it's important to highlight this historic perspective, because this might be relevant for some people, definitely relevant to the US, but also shows that sometimes junior doctors are spoken for instead of spoken to. So there is this landmark case that maybe some of you have heard about that happened in 1984, before almost all of us were born, I think. There was this young woman, Libby Zion, who passed away at age 18 in a hospital in New York from a drug-drug interaction. I'm not going to tell you which drugs, because even when I started practicing, we didn't use those drugs. So they're not going to be familiar to anybody, but clearly a pretty severe drug-drug interaction that caused serotonin syndrome that went unrecognized, and she passed away. Her dad was a pretty big journalist who took this on as a crusade to try to change the realities of working hours of junior doctors, because that mistake was blamed on long hours, fatigue, etc. And it wasn't really directed at any specific resident per se. It was really mostly recognizing that this was a system issue. And this has brought on repeatedly these conversations in the American College of Graduate Medical Education, or ACGME, that I think many of your ministries of health, we heard from colleagues in Korea, bring up the ACGME as the model of what working hours restrictions should be. And they've reconsidered working hours, etc. Right now in the United States, it's an 80-hour week limit with a 24+4 maximum, so 28-hour call, and really a 1 day off on average per week. So these are general big lines. And even to get there, there has been a lot of different changes. And I want to recognize that sometimes we are our own enemy, because a lot of times senior physicians in the education space are the first ones to say we shouldn't limit working hours because that limits quality of training. And I think Jack earlier sort of alluded to that. Then there were tons of studies that were funded by ACGME. Mostly, if you look at the literature that is available out there, a lot of it is from the United States, because those studies were commissioned to be done to look at patient safety, to look mostly at patient safety and errors, rather than well-being of residents and junior doctors. So this is where I would get us to where we are today. I think patient safety is a really big argument. It's not something that in our study we're going to be able to really quantify. This is a global study. And unfortunately, these kind of patient outcomes are very, very difficult to do at this very big picture level. So what we're aiming to do here is a little bit of thinking about what Juan Pablo was mentioning a little while ago, which is looking at how many hours are residents at different levels of training in different specialties in different countries around the world. How many hours per week are they working? How many successive hours without an adequate period of rest, which is usually considered as 8 hours? How many days off per year do residents have? How many days off per month? Do they work night shifts, etc.? And this is what we're aiming to truly quantify. In this case, we're really not going to quantify any mental health symptoms or diagnoses. We're really not going to look at well-being or burnout because many of these tools are often validated in either a specific country, sometimes in a region, but are very, very difficult to generalize to the global level. So we're really strictly restricting ourselves to hours, specialty training, rest, et cetera, et cetera. We're also looking at what are the national labor laws? Is there a working time restriction in a specific country? Which for Europe, it's pretty clear. It's a decision that is already out there. Are there such labor laws in other countries? And if so, is this taken into consideration by employers of these junior doctors? Which my presumption is going to be a no, but I'm very, very interested to see what we're doing. Why did my particular research group decide to embark on this journey? Pablo alluded to the fact that I'm a big supporter of the JDN. I think absolutely. I believe the JDN and the World Medical Association have had a great positive effect on me as a person, but at the same time, I'm a big advocate for health workforce in general, and particularly for physicians and physician well-being. We are very heavily experienced in qualitative research methods, which is exactly what we're doing here. We're utilizing a survey in order to gather data around the issues that I was talking about here briefly. So a couple of things. I don't want to bore you too much talking about methods and numbers, but I do think that it's important for us to point out how do we really make the best, if you will, out of this survey, and how do we get you the tools for advocacy to be able to take home. So as you can all imagine, I think everybody's familiar with some of the statistics, power of each study to detect statistically significant differences, etc. So in reality, all of this truly applies still to surveys, even if you're considering that this is a qualitative method, which it absolutely is, but many of our outcomes are actually pretty discrete. So we will be doing power calculations in order to be able to tell statistically significant differences between countries, between regions, between different subspecialties, etc. So what I'm trying to say in short is the more survey answers we have, the better we'll be able to answer some of these questions, specifically inter-country differences, inter-regional differences, inter-specialty differences, or similarities. But I think what I'm trying to say here is a very strong message of if we work together to get the most answers, then we are going to be able to give you the best quality of data that you're going to be able to utilize in the future in your advocacy journey, locally, nationally, regionally, etc. So a couple of additional points to mention is this is where all of us are working together to get the more data for the advocacy messages with the goal of developing a global report that is essentially a work of the Junior Doctors Network and all of you JDN members that we're also, of course, going to support in the analysis and the drafting. But we're also in parallel doing a scoping review, a more recent scoping review. Multiple of those have been done throughout the last several years, particularly, as I mentioned, when the ACGME in the United States had done this journey towards limiting long shifts and hours per week. So a lot of these studies were from the United States. We're going to go and look back and see, since those last scoping reviews, have there been any new information coming from any other country around the world? So this piece of work will also be coming to you, hopefully for you to see what others are doing, what peer-reviewed data is out there, but more importantly, also to support the advocacy message that is going to come out of this global report. I will say, of course, our hope is to get this work also in the peer-reviewed literature, because multiple people and higher ups really love to know what the impact factor of the journal that you're publishing in and having said that, I think a report from an organization such as the World Medical Association and WMA JDN will carry its own weight as a standalone report. But of course, we would love to see this data in the peer-reviewed realm, cited and utilized also by people who might not be connected to our organization and the global health policy space. Lastly, I would like to mention that also reiterating something that Jack had also alluded to before. We completely understand that there are work itself, there is a work culture that differs between regions of the world, between countries. There's also a work culture that differs between different specialties of medicine, and we are fully cognizant of that. The goal of this report is not to say at the end, you should restrict people to 40 hours or 60 hours or 80 hours. Absolutely not. It's just a tool that you will be able to contextualize and utilize, hopefully with a good enough power to utilize that data in your own national advocacy. We heard our colleagues from Asia at the last Junior Doctors Network meeting in Porto, who mentioned that when you are starting for 120-hour weeks, coming down to 40 is really not realistic, and that's not what their argument is. And we're very cognizant that this is really what the study is not seeking to do, because we understand the differences, as I mentioned. So hopefully, though, it will still provide you really great data to utilize in the future. So I am going to mention specifically the things that are really important for us. And then I know that Pablo and the JDN have a specific plan as to how to engage national representatives of junior doctors that I'm going to pass it on to him. But my call to you all, if you are a national representative, but also if you are a JDN member who has colleagues, residents, friends around you in the hospital, in your region, previous medical school colleagues, if you are on WhatsApp groups from your prior time in IFMSA, I highly encourage you. This survey, if you haven't completed it, I hope you will complete it right after this webinar. It is a very short survey. We have it translated in the 3 official languages of the World Medical Association, so English, French, and Spanish. And we really hope that you will answer, but you'll also share it with anyone around you who would be willing to spend a little bit of time to participate in this project, with the goal of hopefully providing data that will improve working hours and working conditions of doctors, junior doctors globally. I think I will stop here, Pablo, and turn it back to you.
Thank you so much, Kalin. And just to complete a bit more this part. So now this study has been already launched a few weeks ago, but today we wanted to make like this special official launch. Again, this study comes together as a collaboration with the European Junior Doctors Association, which had the first original study. We will have a specific webinar early next year where we will invite also the AJD to present the REST report, which is the first results that they already got from this baseline study. But again, as Juan Pablo and Kalin already mentioned, the expected has been shown. Long working hours and insufficient rest was shown in junior doctors across Europe. That there's a systemic problem in the European health systems, longer hours than permitted by the European regulations, among other discoveries. But now coming back to our study, it's officially launched. We will be resharing again with all the participants by email. But you can directly participate. You can find the QR code and the links in our social media, as well as by email that we will be resharing as well with all participants. It's a really short survey. It takes from 5 to 6 minutes, and we have already translated in 3 languages. This is really important because we realize that, of course, as diverse as we are, we wanted also to be much more inclusive, even though we are aware that much of the research it's done in English. We still wanted to give this as this first study, these 3 official languages from WMA. But we have been already collaborating with some of the national junior doctors representatives. We've been already in touch, for example, with the India Junior Doctors Network members, with Kira, that is the intern, the Korean Intern Residents Association, and also from Ecuador, which they have take ownership also of the study in the way that, for example, in Korea we have the translation in Korean, even though the survey is in English, as well as they take the ownership to distribute among their members. I know some participants here might be also part of their national medical associations or other networks or social or scientific societies. So we highly encourage for you to get in touch with us. We have already prepared some templates and materials that you can use to distribute this study among your networks. And even if you're a junior doctor, just participating and spreading the word with your members would be already an amazing opportunity for us to spread out the work. This is the first ever global study that it's been done. So of course we want to get us as many responses as possible. And we highly encourage each one of you to take a few minutes just to review it, answer, and also to share it. Because of course, coming a survey as this one from a trusted colleague has a much higher response rate than if we would be directly targeting. So we would highly appreciate if we would get your support on this. And before we address some of the questions that I see on the chat, I know that some of our speakers will need to leave a bit earlier. So Jack or Maren, I would like to know if you have any final reflections before we open the floor for the questions.
I'm just so excited to see this kicked off, and I'm looking forward to questions and comments from our audience.
Thank you so much, Jack. Maren?
Thank you. Yeah, I can also just say I think this is a great study. I wish you all the best. I hope you get a lot of participants. I'm looking forward to seeing the outcomes. And I want to thank you again very much for the invitation. And yeah, just all the best. And to all of you, I really apologize that I have to run to another appointment. If there are any questions, feel free to contact me. And I wish all of you a peaceful end of the year and also a happy and healthy new year ahead. Thank you so much.
Thank you so much to you, Maren. So I see we have already one question, a few questions in the chat. The first one is how do we get to collaborate with you? Is there a plan to develop, a report specifically for low and middle income countries to deal with specifics in the unique circumstances of the LMICs? I don't know if, for example, Kalin, would you like to probably address this question?
Yes, absolutely. So the goal of the study to start is a global study. But as I mentioned, the more responses that we get from individual countries and region, the more we're going to be able to analyze this data with the specifics to be able to support LMICs, specific regions, specific countries to develop their own version of this subset of data. So what I'm essentially trying to say is if you have an interest in I will say LMICs are also it's a very broad generalization, right? So I think in a specific region, more likely, please encourage your colleagues to participate. And if we have enough responses to make it a statistically significant analysis or powered enough to give you meaningful results, we would love to have a dedicated section to a country, to a region, etc., with the ownership of this data belonging to the colleagues who have supported that work. So absolutely the answer is yes, but we won't be able to make any specific plans without seeing the number of responses from that particular area of interest, region of interest, country of interest, to be able to plan what to do with a subgroup analysis of the data that we have.
Thank you, Kalin. Also now addressing the question from Dr. Supanan from the Thai Junior Doctors Network. First of all, it's great also to connect. We will make sure that you receive the information to be also in the national representatives channel that we have worldwide. But about your question on it's presenting already the problem in Thailand of junior doctors. and also wanted to know more about the tools used for data collection. So we will be sharing also with you if you want to engage directly the Thai JDN in the study and also help us spreading out the work. But it's true that this is not the first time the junior doctors network or the WMA is working on the health workforce. We've had a specific session actually on the past fall meeting that we had in a hybrid format in Porto, in Portugal, where we had different country representatives or country members from the JDN that presented their situations of junior doctors. We're still pending to have a report or an article from all those insights that we received. But I think joining the JDN and participating in the different discussions that we have is also a great way to move forward on this. Okay, I see that there's also some other questions. There's some comments saying that thanking about the speeches.
While you read the comments, Pablo, may I say something?
Yes.
I was thinking about when we started our project in Spain, and we had a lot of concerns like, oh my God, we are not going to reach the quota, or we are not going to receive enough answers. And this wasn't true. The fact is that a lot of medical residents and junior doctors are motivated to answer this kind of surveys and questions because they are feeling these problems in their bones. So don't be afraid of trying to reach the quota or trying to reach as many answers as possible, because when you start disseminating the survey, you will be surprised of how many people is motivated to answer and how many people is motivated to participate in this kind of projects. We were really surprised in our case and happy with the results. So be strong because it's worth it.
Thank you, Juanpa. And probably elaborating on this, we realized that, for example, in other studies we've done nationally, that including directly the specialties is also a great way to do so. So, for example, we're already in touch with WONCA, the Young Doctors Movement. WONCA represents the Global Family Medicine organization. And of course, including directly specialties will also help us then do disaggregated analysis. Because this is true, you have also to realize when you take the ownership and you make sure that there's more representation from your country, that will means that then the statistically it would be also more significant. And of course, our idea is later on, once we have the data, to be able to hand over, these reports, this information for each country also, to use this, as we've seen that, for example, Spain have done it in the past as well. So yeah, I think it's really important to take this into consideration. Okay. I think, yeah, Michael was also asking about this part of the disaggregation of data that we for sure we will be doing so. Great. And something that we didn't mention, so the survey officially was opened a few weeks ago, and we will try to have it open for the first months of 2026. So until then, please try to participate. We know that now that we're getting to holidays, will be a bit hard to engage more people or to participate more, or even the shifts are a bit harder. So we will keep on reminding all participants of this event, but also our members. If you are not following yet the WMA JDN in social media, we will make sure to be reposting the information in the next few weeks. So yeah, look to our social media platforms. I see that also here we have a couple of our junior doctors network management team here present, which have been supporting all this study. Of course, it's impossible to have such a big study without all the support of our team. But of course, we want also to include more our members and more the national representatives. So yeah, as we just have a few minutes left, and I know that some of the speakers had to leave early, I would like Juan Pancalin, if you can have some final remarks before we close the webinar. Juanpa, would you like to
Okay.
go first?
Yeah, thank you, Pablo. To finish with, I think that to see why we're doing this, right? Because we're talking about taking care and respecting the rights and the working condition for medical residents and for junior doctors, thinking that we're helping to have a better future for medicine, a better future for the future specialists. So I think these kind of projects help us to understand how our world is changing, what the medical residents and junior doctors need to really learn and do their work safely. So I think it's really worth it. It's not as difficult as it may seem at the beginning. So trust us that it is going to be a success for sure.
Thank you so much, Juan Pablo. Kalin.
It's always great to come after Juan Pablo because I feel very optimistic and positive. I just maybe wanted to answer the last question that I see from Michael, and then also maybe some closing remarks. So we would like to be as inclusive as possible in our study. There's no study design that is perfect. We are dealing with global realities that make it even more challenging. But as I mentioned, we want to make it as inclusive as possible. We are always happy to chat and see if you already have a national survey on working hours and you have data that is pretty similar that we can include in certain parts of the analysis. We'd love to chat about that. As I'm sure you know, with the methodologies of some of the qual data, if it's very different, it is going to be very, very challenging to include within the same analysis and do new power analyses for specific subgroups. But essentially what I'm saying is please reach out to both Pablo and I, or Pablo, and then we can connect the three of us and see what does your national survey look like. And that offer goes for anybody here. And we will see if there is any way to actually include that data into the global survey if you feel like an additional survey or you've done this work pretty recently. Again, any oversight that we have done in any fashion, please feel free to reach out. We're happy to discuss and tell you why we elected to go with the route that we have gone, because we have done a lot of thinking. We also have a very diverse research team with colleagues from LMICs from all over the world. So please do reach out, and we're happy to tell you. I think Paulo didn't really talk a lot about how he's been including national junior doctor representatives, but I will say that there have been discussions, and the work of each one of you will certainly be recognized in the final product. I think in terms of the data analysis, we will certainly keep everybody posted on where we are. The research team does this for a living, if that makes sense, which is why they are happily taking care of the analysis and the research methods. So my research team, essentially. So overall, I think I'm really glad that so many of you have joined and have engaged with us in the chat. This is really a phenomenal opportunity. As I mentioned, my research team and I are delighted to partner with the JDN, and then also discuss and chat with inspiring colleagues who have done this work before, like Juan Pablo. I saw Alvaro's back. Alvaro, hello. And the great folks who have done this work. So really excited for this and to connect with any of you who are interested, who have comments, thoughts for how the study is going to go, and eventually for the final product. Thank you so much. And Pablo, over to you.
Thank you so much, Kalin, and we're just right in time. So we will keep on having some webinars during the study period. But we want again to thank you for the time coming here. We're doing also our best to be as inclusive as possible, considering how broad also the world and the network is. But yeah, we're really happy to bring some light to this really important topic. And yeah, we will look forward to keep in touch. And if you have any other suggestions or proposals, please feel free to reach me out, and we'll make sure to address them on the proper way. So thank you again, and see you in the next events. Bye bye.